Thank you. The chair now recognizes herself for 5 minutes, and I would also urge my colleagues to recognize the care that comes in the community. The reason why a Mission Act exists is because patients weren't getting care. Veterans weren't getting care. They weren't getting access. They were waiting. They were dying. They were committing suicide. They're overdosing. They're dying of fentanyl poisoning. As a matter of fact, in this very hearing room, when we had a hearing on residential care and substance use disorder, prior VA officials admitted that they did not think that residential care or substance use disorder residential care fell under the Mission Act. So it didn't matter if the patient waited 30 days or 100 days or a year, they still weren't going to refer them to community care because they didn't feel it was under, that fell under the Mission Act. This is the VA's own words. Dr. Rente, and I'm an ophthalmologist. And not only have I worked at VA facilities, not only was my uncle, 6 of the 8 kids of my family are veterans. My father is, my husband is, my grandfathers are. My uncle was in a residential facility at the VA for his entire life when his ship went down the Pacific in World War II. And I've done substance use disorder and helped to change policies at the state level. But when a veteran is assessed as needing urgent residential care, how long do you think they should wait? And are you confident that every VA facility applies the same timeline and criteria to get that veteran placed or referred to the community without delay?
Thank you very much for that question. So first let me say that the national policy is very clear and is applicable across the country. The fact that there is variability and a lack of standardization is a problem. There is no question
so
about
if the standard is present, then that means the culture is not permitting the standard to be met. So because the committee continues to hear that policies governing residential treatment and community care referrals are interpreted differently depending on where a veteran seeks care, how is the VA going to ensure that policies are followed uniformly?
Thank you very much. The Secretary has initiated a review.
This would be Secretary Collins?
Yes, ma'am. Has initiated a review of policies, directives, staffing, organization, structure of multiple aspects of the direct care system, as well as multiple aspects of the community care system, in order to be able to begin to answer the questions that you're asking. In general, and these are generalities, when you have policy and it's just not being carried out, there are common reasons for that. Some common reasons is that the policy may not be clearly written. The policy may have broad, subject to interpretation features. It may be that we've simply not adequately trained the frontline staff. And there are a host of other reasons in between those things. Those are the things that we need to address because those are interfering with our ability to provide the access that veterans need to have. It's creating barriers, and in some cases, it may be creating additional administrative steps.
And Dr. Rente, as I mentioned, we have programs like the Gordon Fox Parker Suicide Prevention Grant Program. We have buddy systems within our veteran service organizations that help veterans to navigate some of these things. And I realize that you're a recent addition, although you've cared and done mental health and substance use for a long time, but how do programs like the Gordon Parker Fox Suicide Prevention Grant Program help veterans access mental health care services?
Is that a question you might be able to take, Dr. Wiekers?
Sure. So the Fox Grants program provides grants to community organizations that are helping to engage veterans that don't engage directly with our VA health system. So it really helps to fill that gap in providing access out in the community. There are partners out in the community in helping engage veterans to reduce their risk for suicide. They can also, grantee participants can also access care through VA when they've become a part of one of the programs with a grantee.
So let me just say that, I think that our VA healthcare system, although I don't utilize it as a veteran, nor does my husband, I want to save that for the veterans who have most in need and need that access to care. But nonetheless, I think our Veterans Administration, our hospitals, our programs do a very good job, but they're not always there. And it is those gaps that we're trying to fill, and these partnerships, whether they be in the private sector, in other avenues, that we're trying to make sure veterans have access to care. I think we all want the same thing, but I think to continually denigrate a provider that's outside the VA, just like to continually denigrate the VA itself, both of those attitudes are inappropriate and wrong, because as we've already said, we want the highest quality, most effective care. And sometimes that's at the VA hospital, and sometimes that's in the community, because if you can't get access to care, it doesn't matter how high the quality is, it doesn't matter how effective the program is. If you can't get access to care, you have no care. And given that I'm in a rural area, our veterans like to have access to care when and where they can get it. So with that, Ranking Member Brownlee, would you like to make any closing remarks?